Hi, I'm Dr. Maurer, a licensed psychologist here at the Medical University of South Carolina and NCI-designated Hollings Cancer Center. Today, we will watch the third video in the BRIGHT program. This video is called Psychosocial Aspects of Head and Neck Cancer. This 30-minute video will talk about many emotional challenges of the head and neck cancer experience. I hope you find this information useful.
The emotional journey through head and neck cancer is a life-changing experience for most patients. Whether you're trying to come to terms with a cancer diagnosis, going through treatment, or grappling with fears of recurrence or death, there's no right or wrong way to feel. Up to 75% of cancer patients experience a high level of psychological distress. About 25% of cancer patients suffer from severe symptoms that can be diagnosed as major depression or anxiety. It is important to understand the difference between normal sadness and grief and actual psychological disorders that can affect your ability to deal with your cancer diagnosis, treatment, and recovery. The next video details several patients' emotional experiences through treatment of their head and neck cancer.
When you hear the word cancer, it's a scary thing. It puts your life at a standstill.
For a lot of people, they think of it as a death sentence.
It just paralyzes you sometimes where you can't function.
I did fall into depressions after every surgery.
The minute you hear the word malignancy, everything changes. And I became very, very helpless.
If it does that to me, then it's winning. It's not gonna win.
Maybe it was just my turn instead of someone else's turn. That's okay to me.
The most important thing is to never give up hope. A positive attitude towards anything helps the healing from the inside as the doctors are helping the healing from the outside, and you're attacking the battle from both ends. You gotta fight till the end.
It is common to experience emotions such as anxiety, fear, and depression. However, if these emotions become very severe, you should consider reaching out to your doctor in order to manage potential psychological conditions. Below, we list several signs relating to anxiety, fear, or depression that you can look out for. Anxiety, constant worrying, difficulty concentrating, irritability, restlessness, muscle tension, headaches. Fear, inability to think of anything other than the source of fear for very long, having intense feelings of hopelessness or helplessness, withdrawing from daily life. Depression, feeling intensely sad all of the time with little relief, significant weight loss or gain. Extreme fatigue, sleep changes such as insomnia or excessive sleepiness, feeling inappropriately guilty, having recurring thoughts of death. The next three videos describe patients' anxiety regarding treatment as well as post-treatment surveillance.
Well, the anxiety level really increased was when I started proton therapy, and they put you on the bed or the board. They make a mask for you, and it fits over your face very, very snugly, and you get screwed down to the board. I tried it the first couple of times, and a couple of minutes into it, I thought, boy, if this is going to continue, I'm going to lose my mind in this, or I'm going to try to jump off this table. But it can be difficult. It can be trying. Got to have faith. Got to have some confidence in your doctors, and know that you'll get through it.
The first year, the scans make you very anxious and nervous. Waiting for the results, the news you want to hear is that everything is clean, everything looks good, and to go about your life. So the scans for me in the beginning created a great amount of anxiety. Then I found that having the scans was a great comfort to me. As you move on with the years, the scans were just a reassurance to me and to my family that the treatment that we had and that we chose really worked.
For me, the scans through the 5 years were always filled with anxiety and fear. where Jason found it was a source of comfort, I started flipping out days before we had them, and while he was in the room having them, and after, until we had the results. I was always afraid of the news of it coming back. How would I tell my children? How would we ever go back to going back to treatment? And that was really frightening until we just had the 5-year mark. I would say those 5 years for me, the scans were an impossible day to get through. And the 5-year scan was the best news ever, which means you've really moved past, and he doesn't need scans anymore. So now we go on to x-rays. So for us, it's like a whole new life.
As part of my disease treatment, I had to go through a number of scans. I had to go into some scans where the machines were confining and other scans where they weren't. I won't sugarcoat it. It's not fun to be in machine after machine to make sure that you're going to be okay and that you're going to be healthy. So when I'd lay down and I'd have machinery coming close to my face and I'd have to be in a machine for 30, 40 minutes, to keep myself calm, I would imagine that this machine was kind of ridding me of any cancer that was inside me, and that helped me get through.
The biggest fear most patients experience is that of death and dying. This is normal, but if it does get out of control, this could interfere with your ability to recover and or make the most out of your life. This next video details the importance of expressing your fears and dealing with them in a productive manner.
If it's at all possible to talk about what you're most afraid of, I think it's important to do it with somebody who can actually help and sort of hold your fears and partner with you and help you in a way to shoulder the burden of not knowing. Once you face the fears, it's possible to start thinking about a strategy to deal with it. That one of the best things you can do is to feel confident in your treatment and in your team, and to feel that you're doing absolutely everything possible to have a good outcome. But even if you do all of that, the fears may remain. So different people cope with this diagnosis of cancer in different ways. If you find that you're constantly thinking about it and crying every day, and just everything seems to take you back there, and you're not finding even the ability to find joy in everyday experiences in life, then there's a problem. And there may be so much anxiety or even a mild depression as a result of the diagnosis that really needs to be addressed. Even anxiety and depression, which may very well be a result of the cancer diagnosis, can be treated and can be treated successfully.
It's very hard to distinguish what's a clinical depression from what can be predictable responses to chemotherapy. And if you are really troubled by these feelings of, sadness and a feeling of just being totally immobilized, you do need to talk to your doctor about that, because sometimes those feelings can be alleviated with some medicine. And many people who have been treated for cancer and have completed their treatment and moved on with their lives say that it gives them a different perspective, lets them look at the world differently, lets them value everyday relationships, everyday experiences in a different way. So if we can take anything out of what is a difficult experience that we wish didn't happen to people, but I think we can see that sometimes it can really change how you look at your life moving forward in a positive way.
Fear of recurrence may be one of the emotions you may be facing. This next video illustrates how certain patients handled the emotional toll of their cancer recurrences.
Just when life was starting to get back to normal, I had a recurrence.
So I've had a few recurrences, and the last one was 2009.
When I was 15, I had thyroid cancer and had my thyroid removed. Then 13 years after that, 2 years ago, I found a lump in my neck and, never even thought it was thyroid cancer. For those years, I thought I was cruising.
It was a shock again. You know, I was just then changing my whole life around, and then that gets thrown in.
Having the recurrences was not a happy time.
You know, not again. You know, can't believe it's happening again.
Bam, it was again, and I think I really struggled with the second diagnosis, more so even than the first.
You know, am I gonna just crawl into bed and lay down for this? This is my life, and I have to fight for it.
I don't want to say that it got easier, but the first one, I didn't know what to expect.
Obviously, it wasn't as bad as the first time because I knew what to expect.
But then I had a sense, and I had a sense of our doctor, and I had really a great deal of confidence.
Sophie and I, we were able to pull together and say, you know, it is what it is. Let's take care of it. Let's deal with it. And I've been cancer-free for 3 years, and I am ecstatic.
I think what doesn't kill you makes you stronger, and I guess that's how I feel about those recurrences.
You might also find some relief by seeking out support from family and friends, support groups, and spiritual advisors. Simply voicing your feelings rather than holding them in can help you feel less alone and more in control. Next is Dr. Shapira, a medical oncologist, detailing the importance of receiving mental health support during your cancer treatment.
Asking for and accepting help from others is an important part of coping with the stress that cancer can bring.
Everybody diagnosed with cancer needs help of some sort. Maybe it's informal help from loved ones, family, and other folks in one's community. And maybe it's formal help from trained professionals, such as a social worker, a psychologist, or a psychiatrist. There are other ways of asking for help and getting help. These days, many people find help through online communities. People find help also in formal support groups that are led by social workers in medical settings. People may find help in their church or faith community. So there are all sorts of ways of finding help. A lot depends on what you bring to the diagnosis of cancer. You bring your temperament, you bring your personality, your mindsets, your beliefs. But I think the most important thing in my message to anybody diagnosed with cancer is that it's important to feel connected. It's important to actually be sincere enough and self-aware enough to know that it is a good time to get some help. It's a time when typically people need to organize their feelings, gather a lot of information, and establish a good circle of supporters to get them through what's going to be a complex journey. Being diagnosed with cancer is not just something that you can add on to everything else that you're doing. It's not just one more item for your calendar. It really requires an enormous effort.
While getting help from friends and family is a positive step, there are several warning signs to look for that may mean it's time to ask for professional help.
Being unable to sleep at night, waking up during the night, perhaps eating too much or too little, perhaps feeling nervous or jittery, some physical symptoms that indicate that one is living in a state of high stress or high anxiety, or some even emotional or psychological issues, such as not being able to organize one's thoughts. If somebody has a very difficult time making a decision about treatment, if they're very anxious about receiving test results, those are clues to the clinicians and maybe also to the members of the patient's family or other loved ones that that person really has enormous amounts of distress. In the same way that we offer relief for any physical symptoms such as nausea, fatigue, or pain, it's important for cancer clinicians to offer help also for distress or anxiety, depression, and other mental health problems that are incredibly common during a cancer journey.
Oncologists typically talk with patients about their emotional well-being, but if a person feels like they need emotional help and support, they should not hesitate to talk with any member of their cancer care team to get the help that they need.
Some patients are very connected to their primary care physician, for instance, and may be more comfortable at visiting their primary care just to debrief after conversations, or maybe asking for a referral to a psychologist, social worker, psychiatrist that they know, so that they can really have a one-on-one. Patients can also reach out to their infusion nurse, their nurse practitioner, their oncologist, and just directly ask for help, ask for a referral or recommendation by saying, look, I'm struggling. I'm having a very hard time wrapping my head around what's happening, or I find myself unable to sleep at night.
There are times that cancer survivors may experience increased anxiety or feel more vulnerable and distressed, such as the time of their diagnosis, when active treatment ends, when tests or scans are scheduled, on anniversary dates related to their experience, and if a recurrence happens. Seeking professional guidance to help cope with this emotional stress can help you and your loved ones throughout the experience.
We recognize and we know through years of research that mental health interventions help people cope. There are very specific ways. There are short therapies, there are supportive therapies. There's so many different ways that specifically addresses cancer-related distress or fear of cancer recurrence, things that are so common, the anxiety before scans, dealing with news, making decisions. There are so many interventions that we now have that actually help people address it and be more confident as they go through cancer treatment, and also when they finish active cancer therapy.
Healthcare professionals such as oncology social workers, psychologists, or psychiatrists can help you through this difficult period. This next video highlights a couple of patients' experiences working with oncology counselors and therapists.
What I didn't understand was that there were counselors specifically for cancer. So I started seeing an oncology counselor. It was free. And the first thing I said to her was, I'm almost done treatment, and now I'm so depressed I can't get out of bed. And her response was that you're exactly where I'd expect you to be. You've been at war for your life. And now that things are starting to wind down, you're realizing, like, holy cow, I had cancer. And all the emotions are bubbling up. She pointed me to exercise programs, and to start out very slow, I was very weak. So that was an eye-opener for me. But I also, through the counselor, started taking a poetry writing class and a journaling class. And it was with other survivors, and I felt very comfortable in that environment.
And if you need to go to a therapist, it's not to be embarrassed to say, oh, I'm going to a therapist, I'm crazy. You're not crazy, you're just really trying to fortify yourself in order to cope, because you definitely need everything. You need an arsenal to get through this.
So cancer is, as I said, a very traumatic and dramatic diagnosis for someone to receive. And everybody, no matter who you are and how strong you think you are, needs some kind of support.
Your family and friends can be your greatest source of support. This next video details how one patient's spouse was instrumental in helping her throughout treatment and afterwards.
I've always had joy in my life. My husband has never left my side. He has been with me. Don't start now, Marty. It's okay. He gets very emotional. He's been with me through every radiation treatment. He sat there for half days when I was having chemo. He even stayed at times in the hospital with me overnight. I didn't really ever know how much I depended on him until this happened. It totally changed our relationship, and I mean it changed it for the better.
People say, well, you're a caregiver, and I said, yeah, but it's my wife. And people say, well, guys bail, they do this stuff, and I don't know how they can do it. It's your wife. You do what you gotta do, and that's what I did. She's just spectacular, and thank God for everybody, because they did just super. It's amazing what they can do. And we were the lucky ones.
Support groups may allow you to make connections with others who have gone through a similar experience. Next, we will hear from how one patient and his spouse enjoyed the comfort they received from participating in a support group.
I was first diagnosed 12 years ago, and I'm doing real well now. I first started going to the support group perhaps maybe a year after the first surgery, and that was a pretty big step for me because I never was a joiner or particularly a big talker, so I was kind of resisted going to a support group, and they were terrific. They helped me so much at the beginning with things that I was, concerned about as far as keeping food down, sleeping, techniques, things of that nature that were still kind of troubling me, and they were really, really great.
And meeting the people and hearing their voice and not feeling like it was the worst thing in the world. It was not bad at all. And especially because we got to meet, I think it was 2 people, right, that had the exact kind of surgery that he did. So that was really, really helpful.
I got involved in volunteering 4 years ago at our regional hospital, talking to cancer patients, not just throat cancer patients, but every conceivable kind of cancer, to encourage them, to answer their questions. Everyone counts on me to come there and be there. But in many ways, I get more out of it than the patients do. And I think every cancer survivor really owes it to volunteer with other cancer patients, to begin to give back in recognition of all the help and support you received when you were going through difficult times. The advice that I give most frequently is to maintain a positive attitude.
With the treatments that we have today, there's so much hope. There's so many things they can do for you.
A positive attitude towards anything helps the healing from the inside as the doctors are helping the healing from the outside, and you're attacking the battle from both ends.
Sometimes I would get kind of down in the dumps or feeling confused.
You're gonna have frustrating days. There's gonna be days where, you might want to throw in the towel. You're feeling very sorry for yourself.
It gets better, it just takes time. You think that it's never gonna end, and it ends.
There'll be fears, but through that, I would say that the most important thing is to never give up hope.
I try to live that way every day, and some days it doesn't work, but I certainly have hope.
Just know that there is light at the end of the tunnel.
It's got to stay positive and have support.
When it's over, you realize I can relax a little bit. This is going to be okay.
You must remain positive. You can't give up, but it's like anything, you're fighting a battle, a war, and you can't fall down at the front line there. You got to fight till the end.
People like me are living proof of what a positive attitude can do.
Cancer treatment may have a number of difficult to manage side effects. The next video describes a positive spin one patient and his spouse put on regarding his post-treatment experience.
It was 7 weeks of
proton, and then we did chemo once a week.
Immunotherapy once a week.
Luckily, that wasn't a painful experience
No.
for Dennis. It was just kind of changed our diet. We ate a lot of mashed potatoes and
Ice cream.
ice cream,
Yeah.
things that are not normally part of our diet. And we got caught up on a lot of shows. We did a lot of binge watching, learned how to play gin rummy again. So, we learned how to pass the time.
It may be difficult to maintain a bright outlook when facing something as devastating as cancer. However, a positive attitude may help you find strength throughout the post-treatment period. These next videos gives a couple of examples of courage and hope embodied by different cancer survivors.
When I was 6, my mother noticed my left cheek was slightly swollen. Then came the doctor visits. Dentists, pediatricians, oral surgeons, for multiple biopsies, everyone was stumped. We traveled from Buffalo to New York City for 10 surgical procedures in 2 years to finally diagnose and treat a rare non-involuting congenital hemangioma inside my left mandible. The final surgery was a mandibular reconstruction with free flap using a donor bone from my leg. The bone is fixed and is stronger than ever, and now, 5 years later, so am I.
After discovering an inconclusive nodule in my neck, never did I think that one surgery would change my entire life. I woke up from surgery and learned that I had thyroid cancer that had spread to my lymph nodes. When I found out that my father was diagnosed with the same disease this past year, it was like deja vu. His positivity and optimism made way for a speedy recovery, and I got to shower him with the same love and support that he always exemplified to me. Oddly enough, this disease has brought us even closer. We are fighters for each other and will always be by each other's side.
After 29 treatments of radiation and a partial laryngectomy, I was told I needed a total laryngectomy. I thought losing my voice and living with a hole in my neck was the worst thing that could happen to me. Little did I know, the surgery would change my outlook on life in a more positive way. I have a new motto. Cancer may have changed my voice for the worse, but it has changed me for the better.
In 1992, I was treated for head and neck cancer. Months later, I knew it had recurred, but my doctor told me that I was wrong. After several months of trying to get my doctor to take my complaint seriously, a friend who was a pathologist confirmed my cancer had returned. My doctor gave me 9 months to live. I was not ready to give up and found a new team of doctors who gave me hope and removed my tumor. Thanks to their vision and skill, I've enjoyed 24 additional years with my wonderful wife and family.
I am the scary thyroid cancer story. I was diagnosed in 1977 at age 15 with thyroid cancer and had the customary treatment over the years. In 1997, I had another neck dissection for recurrence. In 2010, I found a lump in my lower neck. I was terrified. How could this happen? This time, the cancer mutated into an aggressive form. I had more extensive surgery and 33 external beam radiation treatments. In 2012, I had another recurrence behind the bone of my upper chest. In 2013, I was diagnosed with breast cancer, which resulted in a mastectomy. 1 month later, thyroid cancer recurred in the remaining portion of my sternum. I had surgery to remove my sternum, a prosthetic was inserted, and muscle flap reconstruction was done. I had 30 additional external beam radiation treatments. Now, I have lung and liver metastases. There is no cure for metastatic cancer. It is a life sentence. My current treatment is a targeted chemotherapy agent which slows progression, but will not cure me. I am a cancer lifer.
It isn't as going through any negative in life. It is important to keep a positive mental outcome. It affects more than some people realize. If you have the right mindset and follow the instructions and eat healthy, not the junk food, not the fast food, it can be better. You know, life's not always perfect, but it can be good.
But there is, at the end of all this, there is a life. But that's worth it. I mean, I go out, I mow the lawn every week. I go out, I play softball every week. So I'm pretty much doing everything I did before, except I speak a little bit funnier. That's it.
Well, what I determined was that regardless of what happens, cancer is not going to beat me. I am going to win this. Tried to turn every negative into a positive, so. And I never look at a glass of water as being half full or half empty. To me, it's always full. So as long as I'm up and kicking, I'm going to have a good time.
Hi, that concludes the third video in this 5-part series. I look forward to seeing you next week for the 4th video. When you are done, please close the video and click on the video icon on the iPad to connect back to the program coordinator.